What is the international network on cancer, infertility and pregnancy, and what are the aims of the network?
The network stands for International Network on Cancer, Infertility and Pregnancy. It's a worldwide network of obstetricians, neonatologists, oncologists, and the aim is basically to collect data in a condition that is rare or uncommon. So that means that every own center, every country on its own has insufficient numbers to say something about cancer in pregnancy. That's why we need an international network that collects, that gathers all the data into one registry, allowing us to say something more important about how these mothers do, what kind of cancers are diagnosed, what happens to the mothers and what happens to the babies. So it's an international effort to be able to draw conclusions in a condition that is not common. That is the main objective.
How much is important to have a common protocol for studies and data in the different centers in the world?
Well, of course, to have the same protocol is important if you want to draw conclusions. Because if you have different protocols of different way how you approach women, then it will be very difficult to draw a conclusion, because the conclusion or the result may be influenced by different protocols. So to be able to say something true, solid, you need actually one protocol, because that means that all patients are treated the same way. And only then you can say, or you conclude, you can compare this way with women who are, for example, not pregnant, and then you compare them. But if one of the groups is treated completely different within the group than when compared to other women, then it's difficult to draw any conclusion, because the difference between the two groups may be influenced by the heterogeneity in the protocols. So that's something we want to avoid, and that's why we want to have the same protocol as much as possible. And then you can say whether this protocol is as good as the protocol used in non-pregnant women.
Could the network be useful to have data about the follow-up of mothers and children?
Definitely. So we not only include patients when the diagnosis is made during pregnancy, but we ask the participants also to have follow-up data on the mother. Do they well? If not, what happens to the mother? And also for the children. And this is really important, because we want to know, if you treat the mother during pregnancy, whether the prognosis for the mother will be the same as when compared to non-pregnant women. And we hope that the prognosis is the same and the mother does not have to choose between her prognosis and a child. But that's something we need to know. We need to tell women, if you are treated during pregnancy, then this is your prognosis. It will be worse or the same as when compared to non-pregnant women. So this is important information. This deals about maternal safety, basically. We do believe that this is important, and that's why we ask our collaborators to collect data on the follow-up of the mothers. And this is quite a task, because you have to look always into the files, to update. Sometimes the mother is not treated in your center anymore, she moved to another area, and you have to call the doctors there how the mother or that patient then is doing. So it's quite an important effort, but it's quite very important as well, because we want to inform mothers, fathers, doctors as good as possible about the outcome of the mothers.